Good afternoon, everyone. A warm welcome to all of you for this mini symposium on men. This session is hosted by the Collective Action Against Period Poverty CAP project, conducted by the Family Planning Association of Sri Lanka in partnership French Embassy in Sri Lanka in collaboration with the Celine Foundation. I would like to invite the CAP project owner Olivia Belmy from French Embassy to address us.
Bonjour everyone. I just wanted to speak very briefly on the project. First of all, thank you for inviting me to this session on menstrual hygiene and period poverty. We're engaged for a 2-year project of 600,000 euros on menstrual hygiene and period poverty. When we started the project, we wanted to focus on a bottom-up approach. Still, this approach will prevail with providing sustainable sanitary products, for instance, or improving hygiene facilities in school. Successfully coordinated with the Family Planning Association of Sri Lanka. And I would like to thank you very much for your work. But I would also like to stress and highlight the commitment of authorities, the steering committee, the Ministry of Health, the Ministry of Women, UNFPA, French Development Agency, and European Union delegation. It's really a pleasure to work on a project where more people are getting involved and committed. I really hope it's helping to building this kind of platform where we can discuss this issue that is a shared matter between France and Sri Lanka. Merci, and looking forward to hear this session.
Thank you so much, Olivia Belme. Our moderator for this today is Dr. Ashmira Balasuriya, the technical advisor of the CAP project. She will provide the brief introduction to this session and introduce our presenters also. I encourage all of you to engage actively in this session and ask questions, share your thoughts.
Good afternoon, everybody. Thank you for joining us today for a very interesting panel discussion on menstrual health, hygiene, and period poverty in Sri Lanka. Period poverty is a significant issue not just in Sri Lanka but also globally. It's not just about giving people pads. It's about the lack of access and affordable menstrual hygiene products, access to water and sanitation facilities, the myth, stigma, and discrimination, and also about taxation on menstrual hygiene products. With all these problems, there has to be a multi-pronged approach. Approximately 50% of menstruators in Sri Lanka currently face period poverty. This panel discussion is part of our ongoing efforts to tackle the multifaceted issue of period poverty through meaningful dialogue and evidence-based advocacy. This session will highlight key areas such as national level discussions on statistics and studies on period poverty in Sri Lanka. We will also share findings from a recent study on menstrual practices and policies and focus on eliminating stigma and discrimination while improving access to menstrual products. The objective is to create a collaborative platform where stakeholders can exchange knowledge, offer insights, and identify actionable solutions to break down barriers. We have 3 esteemed panelists with us today, all who have worked quite significantly in the field of period poverty in Sri Lanka. Our first presenter is Ms. Selina Piris, an attorney at law and also the director of the Celine Foundation and creator of the Bleed Good movement, a multi-stakeholder collaborative platform to end period poverty in Sri Lanka. With a diverse and dynamic 15-year career, she's also the director of business development and next generation lead, Celine Sri Lanka, a leading fair trade social enterprise in Sri Lanka. Through the Bleed Good movement, she has created significant strides in tackling period poverty through the development of a reusable menstrual pad, and she will be our first presenter.
So, thank you everyone. Thanks for having us. So, Bleed Good is a movement that is created by the Celine Foundation to empower, educate and enable ecosystem to eradicate period poverty. Celine, which I also lead, is a social enterprise in the handloom textiles industry in Sri Lanka. So, during COVID, we realized we faced a situation where 70% of our business was completely eradicated. We thought, what is a product that can not just create that employment, but also solve a social issue. And absolutely the social issue during that time was the lack of access to affordable menstrual products. 2.5 million women now in Sri Lanka live in period poverty. Bleed Good, it is a co-creation. It is a collaborative platform that has come together with the different stakeholders, inviting the different stakeholders, create this transformative effort to end the problem in Sri Lanka. First, it started as a small project with a buy one gift back kind of model. So every time we would sell product, we would give back into the community. Assistance of donor funding with various organizations who came together really work on our own communities in Kurunagala. And there were learnings and lessons that we learned which we believed should be shared with the rest of the country and even globally. We found ARCA initiative. We worked with the FPA in certain instances. We worked with other organizations to really come together to give that menstrual hygiene education and awareness while we donate, and talking to them about where their period comes from shouldn't be transformative in their lives. That is the beauty of what this movement is about. But more so giving the education and awareness, which I believe is a truly, what I said, the homegrown. Initially, we worked some refugee communities in schools, in rural schools, in temples, and now we have worked in briefly in the plantation community. We worked in orphanages, and we also hope to work in prisons. So this product is in a sense, we donate a pack of 8. The burden on their monthly spending is reduced. In the same time, we create jobs also in the Kurunagala district for the social enterprise. We work with organizations like ARCA to work on to bestow that knowledge on menstrual hygiene and reproductive health. We worked with the Ministry of Health, access to reproductive health clinics. There was times when people didn't even know what a pap smear was. There was a time when a 60-year-old unmarried woman was refused to given a pap smear. We worked with the grassroots trust, the child protection force to use these sessions to raise awareness or to open discussions about gender-based violence. So this platform then becomes a space for people to come together. They leave with networks and knowledge and helplines and numbers, and that is really the beauty of this. While we have consistently learned from the first pad we donated, we have asked our communities, does this work for you? Why doesn't it work for you? Has the quality of your life improved? We have consistently changed our model with every workshop to become better. It's not only sometimes about the social part of what we are doing, but also the environmental impact. We first donated 2 pads, then made 8 pads, a pack of 8 pads, and then that is a 2-year solution. And what we find in our communities is easier to adopt because some of them are already using the cloth. And yes, I think in this session we can talk about the various different opinions and research on that as well, but it's an option, it's choices. Let's not push one thing into our communities. So when it comes to the washing, it requires a certain level of running water and mild detergent and soap. Thorough washing is essential, and education on care and care instructions are available in all 3 languages. Sun drying is recommended but challenging in densely populated and colder areas. Any solution has to have a range of reusable period products that are exposed to the communities. You have to think before you donate. We do need to go that extra mile to understand why we are doing what we are doing. Menstrual hygiene awareness is a crucial component. No distribution should happen without that awareness. Continuous learning is required in order to ensure that there's a sustainable solution. Bleed Good movement is really about understanding that there are different needs, there are different ways we flow, and that when we bleed, it has to be something indicative. So this pad tested to UNFPA specifications. We have been invited by the Sri Lanka Standards Institution. Whatever we do, we have to understand that we are serving a community and we have to go out of our way to give those correct solutions together. Thank you.
Our second presenter, Ms. Nadia Najab, is a senior research professional at the Center for Poverty Analysis, CEPA, leading the Gender and Development thematic. With over 10 years of research experience, she focuses on post-war resettlement, indebtedness, unpaid care work, and livelihood opportunities for marginalized groups with a strong emphasis on gender. She specializes in monitoring and evaluation using the MEAL framework and is dedicated to creating evidence-based, unbiased policy recommendations for gender equality.
Thank you, Rashmira. And good afternoon, everyone. So today, as Rashmira said, I'll be presenting selected findings from the research we undertook which looks at exploring menstrual practices, stigma, discrimination, and access to menstrual products and wash. The purpose of this study was to explore the respondents' knowledge, their attitudes and practices related to menstruation, try to understand the awareness and perceptions influenced by ethnicity, religion, economic factors, geography. We also wanted to understand what menstrual products were available, what people were aware of, what they used. We also wanted to understand what barriers were there in accessing certain products. We also wanted to understand whether access to these products or knowledge about menstruation or practices led to affecting school attendance. We used a mixed methods approach. So there was a desk-based review. We also did a household CAP survey. We also did a qualitative data collection, which involved focus group discussions and key informant interviews. And we also obtained ethical clearance to conduct this study. One thing to remember in the findings that I am presenting today, they cannot be generalized for the whole of Colombo or the whole of Sri Lanka. We reached 602 women and girls who were between the age of 15 to 49 who were menstruating. They were distributed along Colombo, Sri Javardhana Purakote and Thimbrigasaya. They were familiar with the term menses, period, but they also used phrases like Bade Amaru. One of the first things we asked, how many of the respondents were aware of menstruation prior to menarche? An overwhelming 58% said they had no prior information or knowledge. Younger age category, so between 15 to 29, were more aware, while those who were in the older age categories were less likely to have known about this. Primary source of information for those who did say they knew was their mother. 57% said it was the mother who gave them information. It was only 9% who said they learnt it from schools. 97% of them said that they would prefer if they got information prior to menarche and that they should be educated in the school. Interestingly, 98% of our survey sample said that they have used a single-use sanitary napkin. 32% of the respondents said that they have used cloth at some point of life, and this was more common among respondents who were of an older age category. And when it comes to the reusable products like the cup and the reusable sanitary napkin, by approximately 30% of our survey sample. And this was interesting because they said they had heard about it or seen it cultural access or religious associations. There are different practices include being isolated. These findings were significantly associated based on an individual's ethnicity, with 95% of them saying that they were stayed in isolation, followed by 90% of Sinhalese respondents and 80% of Muslim respondents. Almost 90% of our respondents said that they were in isolation. 69% of our respondents saying that they did have a big girl party. Other practices included bathing at an auspicious time or waiting to bathe until an auspicious. We found that those who followed Hinduism stayed away on average 16 days, but we also found them staying away for at least 30 days. 70% of our survey sample tell us that they experienced some form of menstrual pain. Common form of pain relief was having painkiller, taking something like a paracetamol, followed by having a hot beverage or even ignoring the pain. There was misconceptions among those who did take painkillers, or they chose not to take painkillers because they were afraid of delayed periods, disruption to blood flow, a heavier flow in the next month, or even fertility. There is a need for increased knowledge and access credible information. We can use things like existing technology. There are apps now. There's also the need to consider who you are targeting and the timing of these awareness programs. The need to capacitate teachers. And lastly, promote choice in selecting a menstrual product that suits each individual, depending on their... That's it.
Our final speaker, Dr. Asanti Fernando Balapitia, is a consultant community physician with over 25 years of expertise in public health and clinical practice as the Deputy Director and Head of the Health Communications and Life Skills Unit and the Media and Publicity Unit at the Health Promotion Bureau under the Ministry of Health, Sri Lanka. She spearheads initiatives in sexual and reproductive health, menstrual health and hygiene, and sexual and gender-based violence. And I know personally she has pioneered really, I think, with her research in menstrual health and hygiene. We have so little research, and she's one of the few researchers who've done work in this field.
Good afternoon. Menstruation is a natural phenomenon. It's a very crucial aspect of women's health and its influence in their overall well-being and quality of life. Nearly 52% of the population in the female, and among that, nearly 26% is in the reproductive age. So we are going to address the issue in the more than a quarter of the population. Cultural context is the crucial component of under this menstrual health and hygiene. Still in Sri Lanka, menstruation is a taboo, especially with these myths and taboos. Misinformation leads to stigma. This stigma ultimately it's going to affect the health and well-being of the women. Accessible to sanitary products due to this open economy, we can see a range of sanitary products are accessible and available according to their preference, availability, according to the feasibility and their social economical status look for a preference. So there are so many restrictions are there. One of the things is as we know, the economic problems, the economic downturn is the main problem. Poverty rate in 2016 it was reported as a 50%, and in 2019 it has come to the 40%. As a UN organizations, most of them also here, and this CBOs, NGOs, they had urged, especially to the government, to reduce the tax, especially with regarding this menstrual hygiene products. Education and the awareness is the most important area. So according to the study done by me in 2012, I have identified the overall knowledge, satisfactory knowledge, only the 25% among the students. Especially Education Ministry, we know they have a form of curriculum. Recently, they have included that menstrual hygiene part to the curriculum. We developed some materials for the grade 5 school children, Malsamaya Langai, that is also available in the Itaxalava website. Teachers are playing role to convey one message to the children. I think even still, our girls like to get the information from their mothers. We know how much work that CBOs are, NGOs are especially doing to empower this social mobilization at the community level. So we have to appreciate their activities also. Media also playing a big role to have developed social dialogue to remove the stigma. Poor menstrual hygiene, it was reported, it's been absent from the school due to menstrual related problems during the year preceding the survey. The prevalence of the menstrual disorder was reported as 39%. So then, when we talk about especially the menstrual health and hygiene, it also addressed the human rights, then the gender equality, education, health, well-being, empowerment, environment, so that at the national level, we had created a national working team. Altogether, there are 9 stakeholders, ministries are there. Health Promotion Bureau under the Health Ministry. In spite of this economic downturn, government has taken a decision to give free pad distribution. Community engagement is another part. To promote the community engagement, there's a big platforms are there. As well as we are going to train another education ministry also. All these are going to give a positive impact for our program. Sustainable practices, we have to address some aspects. We have to go for the promotion of biodegradable and reusable menstrual products, reduce environmental impact. So until now, we had only the SLSI standard for the reusable pads and the panty liners. Here we are working for these reusable sanitary pads as well as for the menstrual cups. Waste management is going to be a real problem, not only for Sri Lanka, in the worldwide. Here now we have to go for the private partnership. A national guideline, it is not available in the other countries. This is developed by the microbiologist college. So we are going to validate. We have to do a national research. So there, of course, with the help of the UNFPA, we are conducting a research this year. So enhancing menstrual health and hygiene in Sri Lanka requires a multifaceted approach, and that addresses cultural, economics and educational barriers. By fostering collaboration and awareness, we can create a society where women thrive during their menstrual cycle, dignity and health. So hope for the best. Thank you.